An amiable welcome to everyone. This is your Allied Lecdem channel to enhance your understanding. Before going into today's topic, if you had missed our previous videos, you can check with the link below in description. Today's topic is about standard precautions. If you want to know the detail about our today's video, please listen carefully and don't skip it. Standard precautions. First, precautions means in order to avoid the danger or problem in the future. Definition: previously known by various names including universal precautions. Standard precautions are control guidelines designed to protect workers from exposure to diseases spread by blood and other body fluids. We already know about the body fluids. It includes seminal fluid, peritoneal fluid, pleural fluid, pericardial fluid, and etc. They are the basic level of infection control precaution. I repeat that standard precautions means is a control guidelines designed to protect workers from exposure to diseases spread by blood or other body fluids. Who should know about it? Each and every member of the healthcare team should know about the standard precautions because the patients and their family depend on the staff to prevent the spread of infectious disease. History: in 1996, standard precautions were developed by the CDC to synthesize the major features of universal precautions, which were designed to reduce the risk of bloodborne pathogens and body substances isolation, which was designed to reduce the risk of transmission of pathogen from moist body substance. CDC full form is Center for Disease Control and Prevention. And the bloodborne pathogens. Bloodborne pathogens means these are the infectious microorganisms in human blood that can cause disease in human. I repeat that these are the infectious microorganisms in human blood that can cause disease in human. It includes hepatitis B, hepatitis C, and HIV, human immunodeficiency virus. Chain of infection. In chain of infection, it includes 6 links: infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, susceptible host. First, infectious agents. It includes bacteria, virus, parasites. Next, where germs live. That means the infectious agents. Reservoir, people, animals or pets, dog, cats, reptiles, wild animals, food, soil, water. Next, how the germs get out. Portal of exit. Mouth, vomit, saliva, cut in the skin. During diapering and toileting, stool. Next one is mode of transmission. Germs get around. Contact, hands, toys, sand, droplets when you speak, sneeze or cough. How germs get in. Portal of entry. Mouth, cut in the skin, eyes. Next one is next sick person, susceptible host. Babies, children, elderly people with a weakened immune system, unimmunized people or anyone. Standard precautions underpin routine safe practice protecting both staff and patients from infection. It includes achieving optimum hand hygiene, using PPE. PPE means personal protective equipment, safe handling and disposal of waste and body fluids, good communication, training and education. How exposure occur? The most common way of exposure occur through needle stick injury. Next one is cuts from other contaminated shops, scalpels, broken glass, etc. Splashes of blood into mucous membrane, for example, the eye, nose, mouth, or broken skin, cut or abraded with contaminated blood. Needle stick injury. Needle stick injuries are wounds caused by needle that accidentally puncture the skin. If we done the wrong method for recapping the needle stick injury occur. This is an incorrect method and this is a correct method. Incorrect method. It is extremely dangerous to hold a needle in one hand and attempt to cover it with a small cap held in the other hand. That's the incorrect method. One-handed scoop technique. It's a correct method for recapping the needle. Losing this much of blood won't kill you, but receiving this much could. It's an important note. Highly infectious human material or tissues. Blood, body fluids, semen, vaginal secretion, tissues, CSF, amniotic fluid, pericardial fluid, pleural fluid. Amniotic fluid, it is contained in the amniotic sac. Next, pericardial fluid. Pericardium is a two-layered sac-like membrane that surrounds the heart. So the pericardial membrane produces the pericardial fluid. Next, pleural fluid. It is located in between the layer of pleura. Pleura means covering layer of the skin. Less infectious human materials or tissues. Body fluids less likely to contain pathogens. Tears, nasal secretions, sweat, saliva, more likely if blood present. Standard precautions. First one is hand hygiene. Second one is use personal protective equipment. Include gloves, gowns, mask, eye protection, face shield. Standard precautions. These are the personal protective equipments: mask, gloves, face shield, gowns, glasses. Discard needles and other shops in the shop containers, which are located as close as possible to the area of use. Don't recap needle. If any, use the one-handed scoop technique. We already know about that one-handed scoop technique. It's a correct method to recapping the needle. First, visually check shop container for hazards before handling. Make sure the container is not overfilled or damaged. Check the container is large enough to fit your shop. Second one is put shop container immediately after use. Keep your hand behind the shop tip. Keep your hand like this. This is a correct method. Cleaning spills. Before cleaning spills, we should wear gloves and other personal protective equipment. Absorb. Wipe up the spill with an absorbent towel, clean with detergent. Apply disinfectant to the contaminated area using sodium hypochlorite. Sodium hypochlorite is the most important disinfectant for cleaning the contaminated area. Dilution is 1:100 and the time is 5 to 10 minutes. Hand hygiene. Hand washing, alcohol based hand rub. Use of gloves does not replace hand washing. Gloves போட்டா hand wash பண்ண தேவையில்லை அப்படின்னு கிடையாது. Gloves போட்டிருந்தாலும் after removing the gloves நம்ம hand wash பண்ணணும். Next, gloves must be changed in between patients. அதாவது ஒரு பேஷண்ட்ஸ்லேருந்து இன்னொரு பேஷண்ட் நம்ம ஹேண்டில் பண்ண போகிறப்ப நம்ம gloves கண்டிப்பாக மாற்றணும். When to wash our hands. If hands are visible dirty, solid hands with blood or body fluids, after contact with blood, body fluids, secretions or mucous membrane, after contact with intact or non-intact skin. Intact skin means healthy or moisturized skin. Non-intact skin means these are the area of the skin that have been opened by cuts, abrasions, scraping, etc. In between patients, after removing gloves, after using bathrooms, before direct contact with patients, before handling clean dressing, before preparing or handling medications. Hand washing steps. First one is rinse our hand by using water and use soap, and then wash your palms. Scrub each finger and finger interlaced, base of the thumbs, and scrub nails. Wash your wrist, and after that rinse off soap with water and dry our hands by using towel, tissue or dryer. Now our hands are clean. It is a most important method in standard precautions. So I repeat that. First, rinse our hands by using water. Use soap. Wash your palms. Scrub each finger interlaced, base of thumbs. Scrub nails. Wash your wrist, and then last, rinse off soap with water and dry your hands with towel, tissue or dryer, and now our hands are clean. When to use alcohol based hand rub? If hands are not visibly soiled, alcohol rub could be used instead of hand washing. If hands are visibly soiled, that means contaminated, they should be washed first. If our hands are not contaminated or contaminated, better way to wash your hands by using alcohol rub instead of hand wash. Personal protective equipment, gloves, dunning and removal. Other personal protective equipment, dunning and removal of N95 or FFP3 mask. Dunning. What is dunning? Dunning means proper removal of gloves which prevent the infections. How to dun gloves? Take out a glove from the box. Next step, dun the first glove. Next step, once gloved, hands are protected and safe. Fourth step is peel away from the hand without touching the skin. Fifth, remove the second glove by rolling it down the hand. And final step, discard the removed gloves. And we know after removing the glass, we should wash our hands by using alcohol rub. Standard precautions. Means of transmission, 5 main routes. First one is common vehicle through food, blood. Next one is vector borne. These are the infectious transmitted by the bite of infected arthropod species such as mosquito, ticks, etc. Next one is droplet. Next, airborne. Airborne means these are caused by the pathogenic microbes small enough to be discharged from an infected person via coughing, sneezing, etc. And these are remain suspended in the air and can cause infection to another person. In simply, they are transferred from the infected person through coughing, sneezing, and they are remain suspended in the air and they cause infection to another person. Contact, direct contact, indirect contact. And the next, sharp containers should be easily accessible at or below the level of the ice, kept away from the pathways, not to be kept on the grounds, should not be overfilled more than 3 by 4 full, never to be shake to get more space. Accident and injuries. If you are exposed to blood or other potentially infectious or hazardous materials, follow these steps. If you are experiencing a needle stick or sharp injury, immediately wash needle sticks or cuts with soap and water. Splashes to the nose, mouth, or skin should be flushed with water. Irrigate eyes using eye wash for 10 to 15 minutes. Report the incident to your supervisor. Immediately seek medical treatment. Summary. Treat all human blood, body fluids and other potentially infectious material as if they are infectious. There are 3 major blood-borne pathogens. We already know about that. What are they? First one is hepatitis B, hepatitis C and HIV. HIV means human immunodeficiency virus. The most common mode of transmission of pathogen is the hands. Wear proper personal protective equipment in exposure situations. Precaution is better than cure. Thank you.